Hair loss is one of the most common things that I see in my clinic, regardless of what a person is coming in for. A lot of times near the end of the visit, they also mention, I've been losing hair. So today I'm going to be answering some of the most common questions that I get about hair loss that have come in from social media, but they mirror the types of questions that I get in the clinic. We're going to cover them today, and then if you have additional questions about hair loss, make sure to drop them down in the comment section. I'll try to reply to you, and if there's enough interest, we can do another series on this by answering those questions. Hair loss can be distressing for both men and women, and certainly there's more of a stigma around hair loss when it is affecting women. Now, I have struggled with hair loss myself. I eventually gave in, just shaved my head, and I've been loving the results of that. I've been doing it for now 2, maybe 3 years, but I went through every possible treatment you could think of to try to preserve my hair, and ultimately it was not in the cards for me. Looking at my genetics and my willingness to take medicine consistently just wasn't there. So let's dive into these questions, and hopefully you'll find them helpful when it comes to your own hair loss and how you might be able to treat that better. The first question that I got is how to cure hair loss that is caused after extreme flu. Now, after a major illness, perhaps after surgery, or even after a major psychological trauma like the loss of a loved one, the loss of a job, or other major stressors that could happen to you in life, you can experience a type of hair loss called telogen effluvium. Essentially what happens during telogen effluvium is your body goes into survival mode. You had some type of traumatic experience and your body just prioritizes the nutrients that you eat and all bodily functions to just make sure your brain, heart, digestion, that all of those things are working to keep you as healthy and alive as possible. Now, hair growth is not necessarily an essential function for life. And our hair goes through different stages during its growth. We have the anagen phase, which is the growing phase. That's when your hair is getting longer. Then we have the telogen phase, which is the resting phase. That lasts for about 3 months. And then we have the catagen phase, where the hairs fall out. And this happens over a period of about 3 weeks. So on average, we say 3 years for growing, 3 months for resting, and about 3 weeks for that hair to actually fall out. And so what happens during these major stressors is a lot of the hairs, sometimes 30% or more, that are in the growing phase rapidly transition into the telogen or the resting phase. And then about 3 months, give or take, after that traumatic event, you maybe even forgot about it. A lot of people are like, oh, I guess I did have COVID a few months ago. All of those hairs that went into the resting phase will fall out around the same time. And so in a matter of just a few weeks, somebody can lose a significant amount of hair. And of course, that's very distressing. In really severe cases of telogen effluvium, people have even lost fingernails. It just depends on how much stress the person was under and the way that their body reacted. Now, the good news after an event like the flu or other stressful event is that this is usually a temporary phenomenon, and most people, if you just simply give it time and your stress is better managed, your hair will regrow. But it can take time. In order for new hairs to grow and get to a point where they're providing better coverage, that can take 4, 6 months, sometimes even longer if you have slower growing hair. And so a lot of times people will come in and they've had extreme shedding, but they're not really losing a lot of hair now, but they're just waiting for it to recover. And as we go back and we look at their history, we often are able to discover that they went through a stressful event several months ago, and that is the reason for their hair loss. So to cure hair loss caused after extreme flu, unfortunately, it's usually just time. Most of the time you will recover. Now, in some circumstances, you will go into a chronic telogen effluvium, and the hair does not recover the way that it's supposed to. And you have persistent thinning, and sometimes telogen effluvium will unmask and accelerate other types of hair loss, like androgenic alopecia, or the hormone pattern hair loss, which most men will suffer from at some point in their life, and a smaller percentage of women. Sometimes it can also uncover other autoimmune conditions that may start around the same time. But for most people that experience hair loss in telogen effluvium, they will recover their hair in several months. The next question is about hormone replacement therapy and how that might impact hair loss, specifically testosterone blockers and estrogen supplementation. Now, I don't know who sent this message because they were sent anonymously, but I'm assuming this one was a woman because most guys would not ask if they could take estrogen in order to help preserve their hair. If you started taking estrogen, it's a much more potent hormone than testosterone, and guys would likely experience enlargement of the breasts and other feminizing characteristics. And so, yes, generally these types of interventions in women could help to preserve the hair. So if you are suffering from androgenic alopecia, doing a testosterone blocker like Finasteride or Dutasteride can help to preserve hair. What happens is we have testosterone in our bodies, and when that gets to the hair follicle, there's an enzyme called 5-alpha reductase that converts testosterone into dihydrotestosterone. And DHT at the presence of the hair follicle leads to miniaturization or thinning of that hair and eventually falling out. And if that hair follicle sits empty for long enough, it will never regrow. But when we use a medicine like Finasteride or Dutasteride, it blocks that enzyme 5-alpha reductase, so we don't get that conversion from testosterone to dihydrotestosterone. And that way the hairs are not affected in the same degree, and the hairs can actually get larger. It's kind of that anti-miniaturization, and they can have a longer growing period. So testosterone blockers like Dutasteride and Finasteride are one of the most effective ways in both men and women to fight hormone pattern hair loss. Now, as far as supplementing estrogen, this should always be done with the supervision of an endocrinologist or a gynecologist who is very familiar with hormone replacement therapy, because estrogen is a very potent hormone, and you can get a lot of side effects if you go too high or if you're too low. So just exercise caution when supplementing estrogen. If you really are deficient and you need that, then I think that it's okay to use. There were some thoughts due to the Women's Health Study that estrogen supplementation might increase your risk of breast cancer. That was really a minute signal in that study, and the risk was overblown by the media. So this is something to exercise caution with, but if you are a woman experiencing hormone pattern hair loss, a testosterone blocker, and potentially estrogen supplementation under the proper physician supervision could help to preserve your hairline. Next is about oral minoxidil. Does oral minoxidil helpful in addressing hair loss? So minoxidil was originally developed as a blood pressure medication. It dilates our blood vessels, and when you dilate a pipe, more water can flow through it, or in this case, if you dilate a blood vessel, there's less pressure for that blood flowing through. It can accommodate more, and your blood pressure will go down. Minoxidil was found to be a very potent vasodilator, so much so that it really didn't catch on as a blood pressure medication for common use. We still occasionally use it in the hospital for cases where we can deliver the medication regularly because it has a shorter half-life and tends to lead to great drops in blood pressure and then rebounds. And so when we prescribe this for hair loss, what happens is that we get improved blood flow to the hair follicles, and their hair follicles are shown to have a longer growing cycle. As we talked about, that anagen phase or the growing phase of the hair cycle being about 3 years, it can actually prolong that. And so some hairs on your body are obviously programmed to grow for shorter periods of time, and so we can extend that growing period. And we find that oral minoxidil is a really effective way to help promote hair growth. This was originally released in a topical formulation called Rogaine, 5% for men and 2% for women. We found that the 5% was much more effective than the 2%. And now in my clinic, as long as a woman is not having childbearing potential, we generally recommend the 5% minoxidil or Rogaine to use topically. When we use this orally, we tend to go very low doses. So for men, it's usually no more than 2.5 milligrams. For women, typically we're doing that at 1.25 milligrams. They're cutting those pills in half and just taking half of a pill daily. Now, one of the challenges with minoxidil is that it can cause indiscriminate hair growth. So anywhere that you have terminal hairs on the body, if you tend to have chin hair, upper lip hair, you can actually get improved growth in those areas. So it is possible to see unwanted hair growth when you are taking minoxidil. So just be mindful of that. Although it can help to promote hair growth on the hair, if you're growing hair elsewhere, it could become thicker and grow more. And our final question has to do with Finasteride. Can Finasteride be a reason for causing depression in people who take it? Now, this is one of the most commonly reported side effects of Finasteride. Now, finasteride doesn't have a really clear mechanism by which it causes depression, but it has been reported commonly enough that it is on the label, and it is something that we screen our patients for. Now, I've prescribed a lot of finasteride, and I even took it personally for a while, and I did not experience any of those side effects. Of course, that's anecdotal, and I can also say that none of the patients that I've prescribed it to, both men and women, have reported any symptoms of depression, and we screen them for depression every time they come in for their medication refills. And so finasteride is reported to cause that, and for most people that experience depression on finasteride, it will go away upon discontinuing the medication. However, there are reports of a condition called post-finasteride syndrome, and this is where the symptoms that one experiences while taking finasteride do not go away after they stop taking finasteride. Again, it's an unclear mechanism as to how this might happen, but some people have reported persistent depression, and one of the other side effects that has been reported to happen with finasteride is erectile dysfunction. And so that has been reported as part of post-finasteride syndrome, where even after discontinuation, there's difficulty in gaining an erection. So that is important to be aware. Some of these may be psychological, where people are worried about the side effect and then it happens to them because they're more fixated on it. But I think that it's real in many cases. And so it's something to be aware of. If you are taking finasteride and you start to experience any of those symptoms, stop taking the medicine and call your provider right away to know what is the best course of action for you. I will also mention that finasteride can be compounded into a topical formulation. And so if you're worried about taking it orally, you can have it compounded into a topical formulation with minoxidil, and I find in my patients that the combination topically works really well. So it's certainly better than somebody just using minoxidil topically. You're getting extra hair growth from that finasteride. In my practice, we prescribe that through a pharmacy called Hair Stem or Skin Medicinals pharmacy, and our patients have really liked it. It's a good formula without propylene glycol, which is a preservative that causes irritation in a lot of people. And so there are services online like Hims and Roman that also offer these. I think you'll save money by going to a dermatologist to get them, because when I see a patient, I provide them with a year of refills. They don't need to pay me monthly in order to get that. They just purchase their medicine, whereas these subscription companies, they charge you every month, even if you haven't run out. So I don't like the business model quite so much. But finasteride, definitely effective for male pattern and female pattern hormone type hair loss, but there are some risks of side effects. So hopefully this has helped you to understand different causes of hair loss and treatment approaches a little bit better. Let me know what other questions you might have about hair loss down in the comments below. Thank you for watching the video, and I'll see you guys on the next one.